we traditionally had our medical assistants and front desk staff doing a lot of prior authorizations, but they have very little to no medical training. And so having them do a lot of the prior auths, and they didn't know how to answer the questions or what was going on. So this was falling back on the providers and they were getting burnt out. Denial rates were like 80%. And so then the patients weren't getting their meds and things were taking weeks on end. And everyone, I think patients, providers, everyone involved was just frustrated. I had previously managed prior auths at my previous practice. And so, but I had a staff of 2 technicians that worked with me and they just did prior auths all day long for me. Came here, took on all the prior auths in between patient care on my downtime, or dinner time is mostly what ended up happening. Kind of been doing that along the way, trying to hold it all down. But back to the trying to make sure we don't get bankrupt, we don't necessarily have money for extra staff. There's got to be a better way. Someone has got to figure this out. And I do not have the resources or tools to do this. So I had set up a Google alert that was just prior auth assistant for Athena AI. And I just had it on, and it had been on for a couple months. And then when it finally went off and it like found something, I was like, oh, cool. And I jumped on that. The fact that I could even set it up that quickly says a lot in terms of how easy the system has been in terms of workflow impact. We've processed 800 or something prior auths in 5 weeks through your system. Our approval rates are going up. Turnaround time is now, instead of weeks, down to days. It is literally saving 20, 30 hours a week worth of prior auth time at the practice. The mean review time on my side is 2 minutes, whereas before it would take 2 minutes to cover my meds to load. Much less to review and fill out the form. My poor Surface tablet, in terms of uploading and saving PDF files up and down, would overheat. I think I could cook eggs on it, certainly. I had to get a cooling pad just from the saving of PDF files. I did not think that was going to be a major issue. It's not even just filling out the form, it's just the 15 minutes it took to find the documents, create the PDF, save it. Again, the fact that you guys pull the data, pull in the right chart notes for the most part, that in and of itself was huge. My original plan was to roll it out because I thought I was going to need help, because I was so overwhelmed that I was like, I can't do this anymore. We've basically been able to manage it and without having to roll it out. So it's been it honestly worked out better than I expected. And I was hoping for a lot. We were going to spend a full FTE technician. This of value to us is somewhere around, $40,000 to $50,000 that I no longer need to spend. I think we're actually spoiling some of our patients and providers, because now they're like, it's been 3 days. Why don't we have an answer? I'm like, y'all remember how this was 9 months ago? Y'all waited a month. I've also talked to their director of health, and they were talking about bringing in another 2-3 FTEs. And I was like, well, we were going to bring in 2 FTEs, but we at the moment don't need to. And we've redirected that towards a different aspect of our practice. I was like, you need to look into this. My first thing is I have had dinner with my family every day for 30 days. That did not happen before.